Hi guys, thanks for taking the time to watch this video. This video is all about preparing for the AKT exam. It's designed to give you some key, quick and easy tips to allow you to feel a little bit more focused, a little bit more prepared, a little bit more ready when you go into that exam room. My name is Aman Arora. I'm a GP and a TPD based in Birmingham. And I remember doing the AKT exam myself, and sometimes the AKT can play second fiddle to the CSA exam, but it's important to remember it's its own exam, it's its own entity, it needs its own preparation. So the aim of this short video is to hopefully allow you to feel a little bit more positive, a little bit more prepared when you go in and do that exam. So let's get straight into it. Tip number one is to plan things early, prepare things early. Now, like everything in life, I guess, if you plan things well in advance, if you're prepared, you know where you're going, the road to that place generally seems a little bit simpler and a little bit less difficult. So plan in terms of when you're going to sit it to start with. So talk to your trainers, talk to your TPDs. When's the right time for you? Is it middle of ST2? Is it end of ST2? Is it beginning of ST3? Talk to your colleagues, so you get their views on when they thought it was the right time to do it. When there's lots of other stuff, there's times in your training when other stuff's going on, there's times in your training when things are a little bit quieter. When's the right time for you? But plan it. Plan what kind of resources you're going to use. There's so many books out there, there's so many websites out there. People often ask me, what are the best websites? What are the best things to do for AKT? And to be honest, if you've planned well, you've got 6-8 months before you're going to sit the exam, you've got time to get through everything. There's only a certain number of websites out there, there's only a certain number of books out there. And my philosophy is, look, get through whatever's there to help you because you've got time to do it. The college stuff, there's college questions, there's CDs that they've produced, there's question banks that they've done in the college. Go through them, try and find everything that you can to do, but in order to do that, you need to plan well. Plan the things that everyone finds difficult and have a plan as to how you're going to get around them. Statistics, a key thing. People find it really difficult to do statistics. So work out how you're going to get this thing done. So does it mean finding someone that's really good at statistics and asking, can you just spend an hour with me and go through some of the basics? Okay, yes, there's statistics books out there, there's statistics courses that you can go to, but whatever works for you, find it and at least have a plan as to how you're going to tackle this difficult area, because it is a big thing that sometimes people just put their head into the sand and just hope it'll get better or cram it in the last few seconds or the last few days before the exam itself. Organisation is another important thing to plan early. The organisation part of the AKT is something that's very difficult to read about, something that's very difficult to just learn in the last couple of days before the exam. A really good thing you could do maybe is, if you're in general practice, ask your practice manager, can I just spend a couple of afternoons, a couple of mornings with you? I just want to open the post with you, understand what kind of letters come into general practice, ask him or her about quaff stuff, ask him or her about leses, deses, ask him or her about contracts, employment rules, maternity things. They're all stuff that comes up in the exam again and again. So again, they're the best source for that type of thing. But again, you can only do that kind of thing if you plan it, ask them in advance, get some dates fixed. And finally, when we talk about planning, plan how you're going to approach your preparation. So don't just think that, oh, I'll do a little bit of AKT stuff here and there, because as it never gets done. We all know if we don't put things down, if we don't make a plan for it, things just don't get going. Other things come out that are more important, and before you know it, you're a couple of weeks before the exam and you think, where's all that preparation time gone? Whether it be, you say, 30 minutes a day in the morning, 30 minutes a day in the evening, a couple of hours every weekend, I'm going to stick to AKT and do only AKT stuff. Have some sort of plan in place just so that you know you're making progress and things are getting done. So tip one, get planning, get prepared, make things easier for yourself. So the second tip, guys, is to understand what is coming. Now, again, like with anything in life, if you know what's coming, really half the battle is won. If you don't know what's coming, if you don't understand what the end point is, then you're walking blindly and you're going to find the whole experience a little bit more stressful, a little bit more difficult than you would do if you understood it. How can you know what's coming? Use the resources out there. Look at the curriculum guide, the college curriculum guide. Okay, there's the general curriculum guide, but there's one for the AKT. There's things that they're telling you what kind of things do they expect someone who's sitting the AKT, what kind of areas do they expect to need to understand, what kind of areas are they going to base their questions on. So why would you not use that? Why would you not look at that beforehand? So get it out, read it at the beginning of your preparation. When you go through that list, look at the difficult areas. Look at the areas you think, wow, I don't like that area. I'm not really confident in that area. And write them down, whether it be neurology, whether it be statistics, whether it be genetics, whether it be women's health. We've all got those areas that we're not comfortable about. What do we tend to do? Just kind of think, well, let's focus on everything else. I don't like this stuff. And if I do well enough in everything else, then I should be able to cover for my lack of knowledge in that. No, why not start with the difficult areas? You've got plenty of time. The other stuff you'll find easy, you'll enjoy it anyway later on. Start with the difficult stuff, your confidence starts to build, and it helps you in real day-to-day life. So I guess what, this is what, so all the kind of stuff's all about, isn't it? Preparing us for real life. What else can you do? The college produce guidance on areas that trainees generally find difficulty. Get them, open them, read them. Again, why would you not use that information? It's up there, it's telling you these are the things that trainees struggle on sometimes. So if you focus on those areas, you know that you're not going to be one of those people that are going to be on that list later on. Understand the question types. There's different types of question types in this exam. It's not all the same. So again, practice using different types, understand what the ways different question types are put, and get used to knowing them. Again, knowing what's coming is half the battle won. Remember, a quick point about this exam, it's not about how much you know. You can't just look at a curriculum, learn everything, and think that I'm gonna master this exam and I'm gonna do really well in it. Yeah, knowledge is one thing, but remember, it's an applied knowledge test. So it's not so much what you know, it's about how do you use that information and how do you put things together to put it into real life scenarios. And that's what we do in general practice all the time. So don't learn lists, don't memorize things. And think about, if I saw these in real life, what would I do? How do I assess these things? What kind of things are going to be important for me as a GP? And you should be starting to think about how this exam is written. And remember, you're thinking primary care knowledge here. It's not secondary care knowledge. It's not how many different causes of aortic regurgitation or aortic stenosis are there. It's not that kind of exam. It's about, okay, maybe you saw this patient that you think someone's got this. What would you do as a GP? What kind of things are important for a GP to think about, and how do you tackle that problem? So we'll come a little bit onto that in a little while. But tip number 2 generally is understand what's coming, understand what kind of things are going to be facing you when you do this exam, and knowing how to get around them in the first place. So third tip, guys, is to visualize the patient in front of you. You're going to get some questions where there's lots and lots of words, lots of little parts to it. And often if you're trying to figure them out on the basis of reading a question or reading on a computer screen, you can get a little bit muddled, a little bit confused. Visualize the patient. This patient's come to see you. You picture every single part of that statement. You get a 40-year-old lady, visualize it. She's got a history of obesity, visualize it. She comes with unilateral weakness of her left arm, visualize it. See the patient in front of you. That's what you do in real life, and in real life it's that kind of information that you're seeing that's helping you decide what you can do with this patient alongside the stuff that you're hearing. So try and get used to, when you read a question, visualize it, see the patient in front of you, things start to become a little bit easier. Layer the elements, like I say. Don't read everything in one long stretch. See each and individual chunk and layer everything on that patient. Things start to become a little bit easier. Things start to link together when you do it that way. It doesn't seem like, oh, this is a 3 or 4 line question, there's so much going on here, and it's too much to understand. And finally, when you're doing these questions, particularly when you practice, and sometimes in the exam some people do it as well, is cover the answers up. You read the question, you think, actually, what am I going to do? What would I do really in this life? In real life, I don't have a list of options in front of me. And often, if you do it that way, then you end up finding the right answer anyway. Sometimes when you read the question and then the answers first, and then think about the question again, those answers have influenced what you're thinking. It starts to confuse you, and as you know, once you get confused about a question in an exam like this, it can take you 5-6 minutes to unwind all of that and think about it again and put it back into context, and still you end up confused about it. So maybe cover up the answers, and sometimes the answers just come to you and then you double checking to see, is that the one that's there? Yep, tick, fantastic, move on. So tip number 3, visualize the patient, pretend they're in front of you, see them walking in, and you start to understand them a little bit better, and it all seems a little bit clearer. Fourth tip, guys, is to pay attention to the small words in the question. Often we look at a long question maybe, and there's lots of big words in there, and they take our attention, they grab our focus, and often they can influence the answer quite quickly. So for example, you're reading a question, you see the word iron in the question, you have a quick glance down at the answer, you see the word hemochromatosis there, and your mind is made up. That's the link, that's the answer. You've word matched. Resist the temptation to word match. Firstly, you want to read every single word. Every word's been written for a reason. Every word can influence that that patient in front of you and influence that question and therefore influence the answer. Get to the end of the question. Sometimes we read 3/4, we think, bang, got it, I haven't got time to think, I've got to move on, crack on, this exam, time's ticking. Read to the end of the question. It might be the last word that influences everything in that question and changes your answer totally. You hear all these things about medical exams. If you see the word never, that can't be right. If you see the word always, that can't be right. Okay, fair enough. But also pay attention, again, like I said, to the smaller words. Words like usually, words like most often. These are things that totally change a question, because you may have an answer there that's weird and wonderful that you think is the correct answer, but actually, is it most often seen in general practice? Or is it usually the presentation that we see when someone comes to see us, as opposed to go see a hospital consultant in hospital? So think about the small words, read the whole question, read all the way to the last word of the question, and then make your decision on the answer. Fifth and final tip, get a study group, get a small group set up for the AKT. Often this is done for the CSA. People get together maybe on an evening or a weekend every week and they practice role plays and get things working. Great, do it for AKT as well. Find 3 or 4 people that are maybe going to take the exam around the same time as you. I think that's really important. And make a plan to meet once a week, Thursday afternoon, Saturday morning, whatever works for you guys. And do something together. So, whether that means going through questions and discussing the answers. Some people do that kind of approach. Some people choose a topic and they decide, I'm going to teach someone about this next time we meet. And if you do that, then make sure you choose a difficult one that you don't like, so it gets you doing that. But just the very idea of not doing the same thing every single day, not coming home, sitting in front of a computer screen, doing question after question, reading guideline after guideline, which can get dull, can get boring, can get monotonous. Eventually you're going to give up, something more interesting is going to come, and before you know it, the time is gone. You think, where's that 6 months gone? Just the very fact of meeting up with other people, realizing there's other people in the same boat as me, I'm not the only one going through this at this very point, just gives you a little bit of a regular boost, and you feel that actually it can be done, and you feel that you're progressing towards the final exam day. So get a group, get shared opinions about these things, and let things move a little bit more progressively. Thanks guys for sticking through all of that. I know I crammed through a lot there in a very short space of time. Just to recap those 5 key tips then, it's all about planning early, it's all about being prepared in advance, it's all about understanding what's coming to hit you. Again, if you know that, half the battle is won. It's about visualizing the patient. Don't just see the words, see the actual person sitting in front of you, it helps. It's about remembering the small words, things that change the question, usually, sometimes, maybe. And it's something about getting a small group set up. I think that's really useful and it will help with preparation in a long way. Overall, it's about staying positive. This exam is doable, it's very passable. And remember, it's not about how much you know, it's about how you apply your knowledge. And remember, they're not out there to trick you. There's lots of resources out there that you can use. They can hopefully mean that your preparation is thorough and you feel, like I said at the beginning, focused, feel positive, feel ready for the exam, and feel well prepared when you walk into that room. Thanks for your time. Hope to see you again soon, and good luck.